Welcome to this video on present tenses in healthcare. What we're going to do is look at present progressive or continuous tense and the present simple tense in healthcare situations. First, let's review what those two verb tenses are. Here we have the present simple and the present progressive or continuous. It's the same thing. In the simple present, remember that the focus is permanent or habitual, things that are not changing, things that are a habit, things that are routine, okay? So the example, I work in London. This is the permanent job and there are no plans to change it. Also, there are key words that you can listen for. Always, usually, every day. And those words indicate that you should be speaking in the simple present tense, okay? Now, the present progressive tense is used for things that are temporary or in progress, things that are changing. The example, I am working in London. Okay? If you say this to someone, they will ask you for how long, because am working means that this is a short project, temporary. The key words for present progressive are now, at the moment, currently, which indicate that something is temporary. So now, what do these look like in healthcare? Let's look at some situations. Pain, medication, and symptoms, okay? If we're using the present simple tense to talk about pain, my back hurts often. This is a general truth. It's not changing. Your back just hurts most of the time, okay? Medication. I take aspirin for pain. Again, this is a habit, a general truth for you. When you have pain, you take aspirin, okay? And symptoms. I have allergies in spring. Again, a general truth or fact for you, something that does not change. It is the same every spring. You have allergies. Now let's look at the present continuous. For pain, my back is hurting right now. That's a new health problem, a current health problem, and something you want fixed today at the doctor's office. Medication. I am taking a new pill this week. Again, something that has changed, okay? It's temporary. And with symptoms, I am sneezing a lot today, okay? So sneezing a lot, this has been a change in your health, something new happening, okay? So here's a way to think about it. The present simple tense we can call the always rule, things that are true or have been happening for a long time. For example, I have a peanut allergy. That is not changing. That is a general fact and truth about you and your health. Present continuous, present progressive, is the right now exception, used for things that are temporary or moving, which means changing. My throat is swelling. That's a current, new, hopefully temporary problem. Right? So, usually when you go to a doctor's appointment, they begin by asking you about your general health history, okay? Facts, habits, truths about your health. For this, we usually use the present simple tense, okay? Because we're talking about our health history, which means we're talking about things that are not new or changing. Let's look at some of these questions and answers. Do you have any chronic health conditions? Chronic means all the time. You could say, yes, I have asthma. I have diabetes. I have a heart condition, okay? Or no chronic health issues. Do you take any daily medications or vitamins? Yes, I take blood pressure medicine every morning. Yes, I take anxiety medicine every night. Okay? Again, it's your habit, it's your truth, your routine. Do you smoke or drink alcohol? I don't smoke, but I drink coffee every day. Okay? A reminder here to be honest with your healthcare provider. Okay? They're not asking to judge you, they're asking so that they can support you and your health in the right way. Okay? So if you smoke or if you drink alcohol, okay, tell your doctor or tell the nurse that's asking you. So you could say, yes, I smoke 1 pack of cigarettes per day. Yes, I drink wine every night with dinner. Okay? So be honest about this one. Be honest about everything, but be honest about that one. And how do you usually feel in the mornings? Right? There's that word usually. I usually feel healthy. I usually feel tired. I usually feel energetic, ready to go. Or I usually feel depressed. It is hard to wake up. Okay? So again, for general health history, we usually use the present simple tense. For the current problem, the reason you're at the doctor's office today is present continuous, right? This is temporary, new, changing, okay, right now. So here's the questions again, and here are some responses using the present continuous tense. Why are you calling the doctor today? I am calling because I am feeling dizzy. I am feeling sick. Okay. Where is the pain happening right now? There's that clue, right now. My knee is hurting and throbbing. My head is hurting and throbbing. My wrist is hurting and throbbing. How is your health changing this week? My cough is getting worse every day. That's changing, right? My cough is getting worse. That means more bad, right? Every day. Are you experiencing any other symptoms? Yes, I am having trouble sleeping lately. Okay. So if we're discussing the current problem, present continuous tense. So here are some examples with a medical professional, and here's my face. Okay. So this would be you. What do you usually do for exercise? I usually go to the gym, but this week I am resting my leg. Okay, so this has both verb tenses. I usually go to the gym. There's my truth, my routine, and that is present simple. But this week, okay, so here's the temporary, here's the new problem. I am resting my leg. Do you usually eat 3 meals a day? Yes, I eat a lot normally. Right? There's my habit, there's my truth. But today I am not eating because I feel nauseous. That means feel sick to my stomach. Okay? So again, I eat a lot normally is present simple, but today, present continuous, present progressive, I am not eating because I feel nauseous. And is your current medicine working? Okay, this sentence is similar again. Usually it works well. Okay, present simple, that's usually my routine. Yes, the medicine, my truth is that it has worked. But lately means temporary, right? Right now, it is not helping my pain. Okay, here's our present progressive, present continuous. Okay. So here's a slide for you to try answering. Okay. What brings you in today? That's a way of saying, why are you here? It's a nice way of saying it. I am here today because I am, and explain your problem today with present progressive. What do you usually do to stay healthy? Usually I, and explain your truth, your facts with present simple tense. What medicine do you take daily. I take and explain with present simple. This would be your habit. Again, your truth. Okay? So this is how to use the present simple and present progressive continuous tense in healthcare situations. Thanks for watching.